Unfortunately, the latest reports indicate that over half the world's population actually don't have access to quality diagnostics. And if we look at that number specifically in low and middle income countries, it actually only drops to 20%. What does that mean? That means 4 out of 5 individuals who go seek care don't have access to appropriate diagnostics. If you think about it from a health guiding principle perspective, if you don't have the correct diagnosis, you likely don't know what is ailing you, which means that clinical care pathways will not necessarily be appropriate given your condition. The other side of it is looking at it from the patient perspective, which is when they come to seek care and we're unable to provide them with the appropriate tools and the appropriate information to guide their clinical care, it is going to be very difficult to establish trust with that individual. And it will be very difficult for that individual to have confidence in the health system, which means that there will likely be a loss to follow up. There will likely be a lack of an incentive to come back the next time they are feeling ill or sick, or their child is ill or sick. And so the whole system becomes a downward spiral. So diagnostics are really a underappreciated tool to build trust and confidence in the health system.
You have attended the World Health Assembly, where there have been discussions about a resolution to strengthen diagnostic services and capacity. What are your thoughts on the resolution and some key aspects?
The diagnostic community is very excited that we now have a piece of policy and a resolution that for the first time really carves out the role that diagnostics play in reaching universal health coverage. And that role will help really mobilize the coordination and the catalyzing of funding to support the diagnostic resolution and its implementation.
To what extent does improving access to diagnostics help move the needle when it comes to UHC, universal healthcare coverage, as a whole?
For me and for many of the colleagues in my diagnostic community, we see the direct linkage. Without having appropriate access to diagnostics, we will not be able to appropriately guide a patient's clinical pathway. And without diagnosing in the very beginning stages of that cascade, we will not know what the disease burden of patients and communities are around the world. We will not know who is accessing care. We will not know what their appropriate follow-up should look like. And so we see diagnostics as really the door, the first step in involving and having patients participate in the health system and really opening the door to universal health coverage. Diagnostics is really that first touch point that a healthcare system has with a patient. And again, if we're able to demonstrate that at a government and even a private level, when a patient comes to seek care, we have the tools and the resources to appropriately guide their clinical pathway, we will undoubtedly see an uptake in accessing facilities and accessing care. So that alone will help increase the demand for seeking health services and proactively participating in the health system.